would like to get into the do's and don'ts, kind of the bread and butter of what happens on a day-to-day practical, someone walks into the office and there's how to avoid an issue. The first one's kind of obvious. Treat the patient the same way as you would treat any other patient. You can acknowledge that they have a service animal. You can even ask them the 2 questions about the service animal, but you don't want to, make a big deal about it. You don't want to sit them somewhere separately. So you want to make sure that they're being treated equally under the law. This is important. The handler needs to be fully responsible for the care and supervision of the animal. And we'll talk a little bit about how to deal with that. But they can't come in to a doctor's office and hand the leash to the receptionist and say, watch my dog while I, get this treatment, right, while I meet with my doctor. They need to be taking care of their dog, including cleaning up after their dog at all times. Almost always, they need to be on a leash or tethered, the dog, unless the device would interfere with the work, or the person has a specific disability that prevents the use of these devices, in which case they should know that and be able to then tell you, well, I can't have my animal on a leash because they need to be able to do X. So when someone comes in, do expect that the person will be taking full responsibility for them, and do expect that the person will have them on a leash. So, someone walks in with a dog in their arms and they don't have a leash and they don't seem to know they need to have a leash. You question a little bit whether they, are just bringing their pet. If there's some sort of treatment that's taking place where the patient is, let's say, unconscious or is going to be in a certain environment where they can't have their pet with them, it is their responsibility to arrange for care for their animal. They need to have a friend. They need to contact a kennel. They cannot, again, pass that off on you. If they do, you are within your rights to board the animal and then charge the patient for the cost of that care. So just want to let you know that reasonable accommodations does not include, becoming a dog kennel. Here are some important don'ts, and this is where people get tripped up. I've already talked about, not making assumptions based on not being able to see the person's disability. A big area of confusion is vests or tags. Again, if you Google emotional support animal, you'll see many companies sell vests that say service animal or working dog or some sort of designation. The ADA does not recognize any of these vests or tags. There's no registration or vest required. Dog can be wearing wearing nothing. I mean, most dogs wear nothing anyway. A dog does not need to have a vest. He does not need to have a tag. On the flip side of that, just because a dog does have a vest doesn't necessarily mean that someone bought it online and it's fake, right? Many seeing eye dogs, for example, are marked as such, just to let people know that the dog is a working dog. Don't ask someone with a service animal to have the animal perform the work it's trained to do. That's one of the questions that I think most people think they would be able to ask. Oh, well, if your dog is trained to do a specific task, let's see it. You cannot ask that. And I think the reasoning behind that is there are certain tasks that the dog will only be trained to do in an emergency situation. If someone's having heart tremors or heart palpitations, for example, they can't make that happen, right? So they can't show you the dog's work. It also, maybe the dog one time doesn't do what they're supposed to do. That doesn't mean the animal's not a legitimate service animal. And then I think also it's kind of a dignity issue for people living with disabilities. So definitely do not ask the animal to perform. Certificates and registrations, no such, well, that's not true. There's no such thing, but that's not determinative. Somebody can have their dog professionally trained and they can have some sort of papers, but if they don't, that doesn't mean that they're not a legitimate service animal. So don't ask to see them. You can ask to see vaccination papers if your local city requires that animals be vaccinated. You can ask to see that for the health and safety of everyone. And a person should be able to provide that. Segregation of patients in a separate area. That's kind of something that, I think people think, well, that makes sense. I'll just set them over here in this really nice area of the waiting room so they don't bother anybody else and they have their own space and the dog's, comfortable. But that is a problem, and you shouldn't do it because it could be seen as treating someone as inferior and not and discriminating against them. So unless there's some sort of specific problem, the animal should be allowed just where you'd put any other patient sitting next to the patient. Areas where this is a gray area would be an allergy clinic. In those cases, you can talk to the patient. You can say, well, many of our patients are allergic to dogs. Would you mind being in this room? Is that okay? Due to this particular concern. And we'll talk about this during the policy section in a few minutes, but I think the real key there is engaging with the patient and giving them some choices and explaining the reasoning and not treating them automatically as inferior or making them feel inferior in some way by the way you're setting things up. The don't pet the service animal or offer it treats. This is one that messes me up as well because whenever I see a dog, I want to pet it. But they're at work, and they generally the rule is that they should not be treated as pets because they need to be focused and on, if you will. So while that's not in any way illegal to do, I just want to note that if someone has a service animal with them, that you kind of want to refrain from engaging with them in the same way as you would engage with a pet.